in line with what government has done post-pandemic, perhaps pandemics and COVID is not yet gone. It has come back to haunt us in one way or the other, because government has rolled out an advisory specifically with respect to the new JN.1 variant, a sub-variant of Omicron, which has now surfaced once again in Kerala. An advisory has been put into place by the government, asking state governments to make room, make arrangements, but also ensure that public health is taken on note of.
I mean, unfortunate as it may be, Shweta, it's that time of the year again. It's holiday season. We've seen people are traveling. We've seen, Christmas and New Year, this long break, vacation time for most people across the world, not just in India. Schools are shut, and this is when social engagements actually go up. And this is when you actually go out and you meet people and you're going to busy malls, you're doing festive shopping, etc. At a time like this, Omicron, the subvariant of Omicron, JN.1, is back. In fact, as many as 2,000 odd cases have been reported, and the death toll has reached a figure of 10 as of last night. I don't have the latest data. I'm not sure if ICMR is actually releasing it like it used to, once in the morning, once in the evening. But we may be looking at, all those COVID graphs and those curves and those, ugly figures of rising COVID cases. And that's not happening in India alone. In fact, countries like Singapore and Indonesia already have enforced fairly stringent COVID control measures. In the state of Kerala, right now, we are seeing these numbers spike, if I can call it a spike yet, because I think given where we were, even 2,000, 1,800 or so seems to be a fairly high number. And in holiday season, in festive time,
the number is going to go up.
If travel continues and if people continue sort of, meeting each other, like we are sitting in a studio, not 6 feet away, not wearing masks, right? So I think in our office, everywhere else, in crowded streets, malls, public transport, airports, these are all busy sort of, areas to be in.
Absolutely.
So controlling this menace of COVID will ensure that there are strict measures in place. And I think the basic hygiene factors that we had become so accustomed to and have now wished away, maybe we wished them away too
back
soon.
To masks,
and we
perhaps.
could be back to masks and sanitizers and distance and washing hands frequently. Great things to do in any case, but something that we weren't doing as often as we perhaps should have done.
Absolutely, but I think an advisory has now been put into place, which is important to note. The government is now asking people to stay indoors, ensure, because this time of the year, as Kartik mentioned, is usually the time when people go out, they shop, they assemble, they gather, and this is the time that the government is asking people to be extra careful of, not to raise any eyebrows and not to ask people to perhaps be scared at the moment, because the virus is still contained in the state of Kerala. Karnataka, the bordering state,
Shweta,
is also on alert.
Are we doing enough testing? I mean, there are enough and more people who are coughing, who are sneezing, who have fever. But the point is, you attribute it sometimes to change in weather. You attribute it sometimes to any other infection you may have picked up. Allergies, given, let's say, cities like Delhi, NCR, where there is such high, severe levels of pollution, which has now come down to the poor category, which we are very happy and proud about. But we attribute illnesses, sicknesses, coughing, sneezing to multiple other things. But are we doing enough testing? Right. And I think the broader point I want to make before we end, Shweta, is that COVID, if it comes back, could have repercussions on the economy as well. And we've seen that in FY21. And there is this economic momentum which is on right now. And there is this quarter-on-quarter joyous moments when GDP
growth
data comes
story
out.
that
Right.
we are
And there is, of course, even if you're not very happy with the employment numbers, but at least we are restricted to late single digits yet. If COVID were to come back and if economic activity were to come to any sort of pause, if not a halt, then all the consumption that we are talking about, and this consumption really accounting for almost 57% of India's GDP, is something that could take a backseat again.
Absolutely.
And that may not spell very well for India's star position and bright spot position in the world, and of course for our own domestic macros as well.
And our health, I think, to top it all, our health perhaps, because the new variant in town is likely to be more infectious than the existing variant. Remember, it's a sub-variant of Omicron, which is anyway highly infectious. Currently in the state of Kerala, where an alert has been issued, bordering states like Karnataka are also on alert. But as far as Omicron new variant is concerned, public health advisory currently in place. People asked to wear masks once again.